In today's Eye on Health, we're talking about important information for women and the men who love them.
Right, January is Cervical Cancer Awareness Month, and while the numbers of cervical cancer are thankfully declining, it's still something women should be aware of so they can take preventative action for themselves and their daughters.
Dr. Sarah Crafton, a gynecologic oncologist with Allegheny Health Network, is here to tell us what we need to know. So first, we should start with how common this is.
Fortunately, in America, this is a relatively infrequent diagnosis. We expect about 13,000 new diagnoses a year. Worldwide, it is very common and affects many women. It's one of the most common cancers women have across the world.
So why is that? What's the difference here? What are we doing right?
We are fortunate to have a good healthcare system and incorporate screening practices as well as the HPV vaccine, which we can talk more about.
Right, and so now what are some of the symptoms? Because I'm sure they can mimic a lot of things that we naturally go through every month.
Unfortunately, many of the symptoms are nonspecific. So the most important thing to pay attention to is irregular bleeding. That means bleeding in between periods, bleeding after intercourse, change in your discharge, or even pain with intercourse.
So as Mikey said, that can sometimes mimic other things. So how do you make sure that you're asking the right questions of your doctor so that you get to the answer you need quicker?
I think by keeping the best information of your symptoms, so by the time you get to the doctor, you have very specific pattern to report to them.
Okay.
As well as paying attention to your routine screening that's recommended. Oftentimes, these pre-cancer changes may have no symptoms at all, so showing up to have routine visits is the most important step.
Because the sooner that you find it and detect it, the better, right?
In fact, we can even prevent cervical cancer if we find it in the pre-cancerous stages.
And how do you go about doing that? Because I know that sometimes it can take a long time to actually get the test done to figure out if you have cancer or precancerous cells.
Exactly. So previously we used Pap tests, which are sampling some cells off the cervix to look for precancerous changes. Most recently, we use the same Pap test in conjunction with testing for the HPV virus that also can cause these changes. Those two factors, in addition to a woman's age and personal risk factors, dictate how often she should be screened and with what tests.
Well, speaking of HPV, there's a vaccine now, right?
There certainly is, yes. The HPV vaccine called Gardasil protects all people against the 9 most common types of HPV that lead to cancer or genital warts. It's FDA approved initially for all people between 9 and 26, and last year the FDA increased that age to 45.
And I know HPV can cause cancer in men as well, but they can also spread the virus then to women. So talk about making sure that people get this vaccine. Is there something that people need to know? What would make them hesitate to get it?
Sooner vaccination is better prior to being exposed to any HPV viruses, so it's strongly recommended by our society, the Society of GYN Oncology, as well as the American College of OBGYN, that children are vaccinated with the rest of their vaccinations through their pediatrician office. That gives us the best chance of preventing this. But even moving forward after exposure to HPV, you can still benefit from the vaccination.
So even if you get the vaccination, you still need to go and get Pap smears, correct?
Absolutely. It is not a substitute for it. You should still follow the same screening guidelines with Pap or viral testing that your doctor will help you through.
Okay, good information. Thank you so much. We
Thank you.
appreciate it. Thank you. And we want to thank you again for being with us and also for sponsoring the segment today and for cervical cancer awareness, Look for more information on cancer care on the AHN website. You'll find that link at pittsburghtodaylive.com. And keep watching for our Eye on Health series here on PTL. It happens on Wednesdays, brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.